Hello guys, now we shall be discussing regarding Tinea Corporis. Our topic of discussion will be Tinea Corporis. So what is the other name for Tinea Corporis? It is called as a ringworm. It is called as ringworm. So what are the important things which you need to know while discussing this Tinea Corporis? First of all, the location is very important. Right, Tinea corporis most commonly affects which part in your body, that is very important. Second thing, obviously all these worms, whatever are there, all these cause infections, they cause rashes. So we should also discuss what is a characteristic feature of the rash. What are the characteristics of the rash? Next important thing is we should also discuss what are the risk factors and the treatment. Risk factors for causing this Tinea corporis, and finally the treatment plan. Okay, let's get started now. So the first important thing is that location. Tinea corporis mainly affects your torso. Now when it comes to the characteristics of Tinea corporis or the ringworm, the characteristics are, so this is a red color rash, so I call it as erythematous rash. I call it as an erythematous rash. Okay, and if you look at this rash, this is circular, I mean it is an annular lesion. This is having an annular region, and if you look in the center of the rash, there is completely empty. So let me show you the rash and then discuss this. This is the rash, right? So this is a rash that is located on the torso. Point number one, that this rash, whatever is there, this is a red color rash, isn't it? So this is an erythematous rash. Erythematous rash. Okay. Next important thing is this is circular. So it is an annular lesion. Annular lesion. Look at the border. Border, it is scaly, right? So it is scaly where in the borders, but in the center region it is completely clean. It is completely cleared. So there is a scaly border with a central clearing. Scaly border with a central clearing. So this is how you characterize or depict the rash. Okay, so this is how you depict the rash. So it is an erythematous annular lesion with a scaly border and a central clearing. So this is called as Tinea corporis. Now when it comes to the treatment, okay, when it comes to the risk factors is very simple. For example, if I have got this Tinea corporis, right, and if I am in contact with you or any of the person, so obviously that person will also develop this. So the risk factors are contact with an infected person. So if you are in a contact with a infected person, then you are more likely to develop this infection. Now when it comes to the treatment, obviously we basically use topical antifungals because this is a fungal infection, right? So we use topical antifungals. Okay, so what are the important things we have discussed? Tinea corporis is also called as a ringworm, that is very important. Most common location is very important. Characteristic of the rash is very important, right? So and next the treatment are topical antifungals. Risk factors, you know it. Okay, so this is all some of the important things which you need to know regarding Tinea corporis. Thank you so much for watching my video. Goodbye.